Welcome to those who have joined. We'll begin in a few seconds. Just letting people join. Okay, so welcome to the final Global Health Landscape Symposium panel, Navigating the Future, Driving Global Health Progress in 2025. My name is Eliana Monteforte, and I'm the Director for International Advocacy and Engagement at Global Health Council. With elections having taken place in over 70 countries in 2024, this is a pivotal moment for advocates to ensure new leaders keep health high on their political agendas. The most recent election in the United States and in many other countries foreshadows a drastic shift in many countries' approaches to global health. So now more than ever, we must come together to find different ways to effectively protect and maybe even increase global health initiatives if we want to think really positively. To explore how we can continue to make a positive impact in global health, we've assembled this wonderful panel for you today. First, we have Ndidi Okonkwo-Uneli, President and CEO of One Campaign, who will talk to us about U.S. leadership in global health. Our second speaker will be Justin Cormier, head of the Washington, D.C. office for the World Health Organization, who will discuss multilateral engagement and give us some insight on what's happening with the Pandemic Accord and how we can continue to move forward. And third, we have Carrie Hessler-Radulette, President and CEO of Global Communities, who will cover health and resilience to address future emergencies and conflicts. And our final speaker is Kate Onijekwe, Vice President for Program Excellence at JSI, and she will discuss sexual reproductive health rights and maternal newborn health, which is an incredibly important topic in the coming year. So before I hand it over to our first speaker, I'd like to go over some logistics. This plenary is being recorded and it will be posted on the event platform shortly after the session ends. And eventually we will be sharing publicly. You're welcome to ask questions in the chat box at any point during the presentations. There will be a question and answer at the end of the panel, and we're going to do our best to get to all the questions. If you do want to raise your hand during the Q&A section and ask a question live to our panelists, please feel free to wait until the Q&A to do that. I can't emphasize enough how much we highly encourage questions. This is really a great opportunity for every one of you here to interact with this expert panel. Please don't be shy. We have a lot to tackle in 2025. So now's the time to really put our heads together and ask questions and brainstorm for next year. Now to our panel. So I have the same three questions for all of you regarding your respective areas of expertise. The first is, what should we be prioritizing in the next year? How can we continue to advance global health priorities in your respective areas? And finally, how do we ensure these priorities align with global health equity goals? So Ndidi, talk to us about U.S. leadership in global health. We know that it's going to look very different next year. How can we continue to advocate while also pushing for health equity and global health?
Thank you, Eliana, and it's a pleasure to be here. I'm so honored to join this esteemed panel, and I want to thank my colleagues at the One Campaign for putting together a presentation, which I'll just run through in response to your questions. I hope you can see my slides.
We can.
Let me put it on full presentation mode. Awesome, thank you. So I'll just rush through and say, all of you are aware that we're living through a miracle. You know, we can get despondent at times, but when we look at what has happened in the health landscape in our lifetime, We've seen a 51% decrease in child under 5 mortality, a 70% reduction in HIV-related deaths, and a 60% reduction in the cost of immunization. And this is promising because we build on what we've been able to achieve collectively as a community in the health landscape. We look at the 2 decades of key milestones in the U.S. History of our health around, the creation of Gavi, the introduction of PEPFAR, which the One campaign worked diligently on, and the impact we had through PEPFAR, and one that really across party lines is celebrated in the US. We think about the Presidential Malaria Initiative, the launch of the Global Health Security Agenda, the COVAX response, and the US engagement in the COVID fight, and what it realized. And we think about One campaign's 20-year history, really fighting for equity and justice. And at One, we really believe that none of us are equal until all of us are equal, and that where you're born should not determine whether you live. And this has guided the work that we've done over the years. So yes, there's lots to celebrate as a community, but then there are some concerning trends. And our One Data team did some really amazing work looking at health financing over the last 13 years and noticed the downward trend. When you remove the COVID numbers and how much was contributed to COVID, we're actually at a 13-year low. And that's really concerning. And this is not unique to the US. This is a global phenomenon in our G7 countries. And when we think about, financial transfers to developing countries, more broadly, we are at the lowest level. In fact, our team looked at ODA for the last 50 years, and that data shows that we're at a 50-year low in giving. So there's a serious concern around financial flows and around commitments to financing. And when we look at the US in particular and the replenishments, there's a traffic jam. That's the term that has been used around replenishments, not just in terms of, Gavi Global Fund, the Pandemic Fund, WHO, but we've seen a concerted trend towards a cut in many of our health programming. And when we look at the appropriation bills from both the House and Senate, we see declines that are quite concerning. And so what now? What should we do as a community, and what should we be focused on in the year 2025 and beyond? I think first we have to rethink our engagement. And I'm from the African continent, and we hear leaders from Africa saying that we really want to demand for what we require on the continent, not what the world thinks we need. And we need greater agency, we need greater voice, we need localization and country ownership. We have to make a greater connection between global health and economic development, because working in silos continues to limit our progress. And I see that not just in terms of the commitment to growth and development, but we see that with ag and food, where we know food is medicine. We see that with gender, where we know women are most hit by the health goals, etc. So we need to really present a holistic perspective around health and the connectivity between the multiple shocks that we face in our world, and why health is cross-cutting but also critical. And then we need to present policymakers with a better understanding of the global health investments ROI. $1 invested in PEPFAR results in $26 or what? What is the number? And how can we present that data in a compelling way? Because we know that on both sides of the aisle, that business case for investment and results is critical. But if I could add a fourth, we need to present a pathway to sustainability where we know where we're going to move to and where that success story looks like and how we can galvanize others. And really, as advocates, we have to be responsible for convincing Congress and the new administration why health investments matter and why we must continue to work as a community to defend what we've already achieved in terms of the gains, but also to push for an end to some of these challenges and essentially work ourselves out of a job collectively. And so we must continue to fight for health ODA investments, for pledges to Gavi and Global Fund. And the pledges are coming, but we need to also fight that our countries meet those pledges and fulfill them. And ultimately, we need to work as a community. One of the quotes that inspires me It's an African proverb which says, if you want to go fast, go alone. If you want to go far, go with others. And I've modified it a bit to say we must go far and fast together. We don't have the luxury of either. And to do that, we have to leave our egos and logos at the door and work with excellence and integrity and determination. And more than ever before, we need courage and wisdom as we enter 2025. And so at One, we are committed to working with you to fight for the funding required, to make the changes at the local level, to push for equity and inclusion, and to ensure that no one is left behind. I look forward to engaging with the rest of you and taking your questions. Thank you so much.
Thank you. That was a great start to the panel. And I love how you said, the country of Africa needs to demand what's required and not just what people say the need is. And in my mind, the way that happens is through civil society engagement. And I think civil society needs to be involved in all of this advocacy because they truly know what the need and those requirements are. And they are on the front lines facing them every day. So getting civil society involved is key. And it's also really important to addressing this health equity issue because a lot of the times they're the ones that can reach those that are furthest behind, know who those furthest behind are, and what their challenges are in terms of health. So thanks, that was really wonderful. I will definitely get back with questions.
Sorry, Eliana, just the continent of Africa. We have 54 countries. I just wanted to point that out.
Thank you. Thank you. So moving on to Justin. So in the context of the recent US election, there's a lot of speculation about how or whether the US will engage in the multilateral space. So tell us a little bit more about this.
Sure. Thank you very much. I will try to be brief because I'm very eager to hear from the other speakers and I'm looking forward to the discussion as well. And I will come back to the question about elections because, of course, it's critically important. But I want to first start on a slightly more positive note, which is to talk about two of the major multilateral negotiations and multilateral processes recently in pandemic prevention, preparedness, and response. Just at a very high level, many of the folks tuned in today are already familiar with this, so I won't go too far into the details, but I think it's worth pausing and reflecting on the success of WHO member states in reaching agreement on a set of amendments for the international health regulations earlier this year. These amendments were approved at the World Health Assembly back in May of 2024, and they represent a shining success of multilateral diplomacy and multilateral coordination to get things done in global health and in PPR. The IHR amendments, the new amendments, as you know, create a new pandemic emergency designation. And for the first time, they build equity as a principle into the IHR implementation and health emergency response. And they strengthen mechanisms to support financing for PPR. And they take some new steps and important steps to strengthen and improve equity, as well as strengthening and improving response and information sharing and planning and preparedness for health emergencies, for all health emergencies, pandemics included. And this is worth celebrating because, in response to some of the trends in elections around the world, not just the United States, but the 70 some odd countries that had elections over the last year, as Eliana noted, we've seen shifts that have impacted and will continue to impact the support for multilateral organizations and for multilateral diplomacy and international cooperation as a mechanism to solving complex collective action problems. And so we should celebrate the IHR amendments, and we at WHO do, and we know you all do as well, because it demonstrates that multilateralism can still have tremendous impact. That said, everyone is also tracking the pandemic agreement negotiations, which have been more difficult. Countries have not yet reached agreement on a lot of key areas in the draft, including how to govern pathogen sample and data sharing, research and development, the sharing of health products and other benefits, financing, technology transfer, and a host of other issues. And so these are really complex issues. They're really hard issues. And while countries have not reached agreement yet or solved many of these problems yet, this process continues. And as you know, Dr. Tedros and WHO have been a very strong supporter of the pandemic agreement negotiations since the start. That's not changed. That hasn't changed by virtue of any election outcomes, though happy to talk about some of the implications and impacts later on. But WHO continues to believe it's critical for countries to come together to reach agreement to solve these problems, because frankly, if they don't, the problems in PPR or the gaps we need to fill, the the ways we need to apply lessons learned and the ways we need to update our governance frameworks, the need is still going to be there. So if countries are not able to reach agreement and make these improvements and solve these problems through the pandemic agreement negotiations, the problem certainly doesn't go away, and we will have to look to other fora or other opportunities in the future to do so, because these will continue to be massive global needs. The U.S. has been a really constructive voice in these negotiations since they started, as you know, and could continue to be in the future. We can talk about the incoming administration and their views on the pandemic agreement. I think they're widely known at a very high level publicly, but the incoming administration is likely to look at the tools that it has available to it and could, of course, they could, of course, decline to participate in the negotiations and decline to support consensus, but they could also work with other member state allies to shape the agreement and engage constructively and try to take the negotiations in a different direction, but ultimately could still contribute to their success. And we really don't know, what they will do at that detailed level. We know that they oppose it at a high level and a political level, and as was their messaging in the campaign, and we're not naive to that. But what they choose to do in the coming months and years matters quite a bit. And then switching quickly to just a couple of thoughts on the election. The election, of course, and the outcome of elections in many other countries and elections to come in Germany and elsewhere, certainly make the context for global health diplomacy and multilateralism more complex, and make the sort of outlook for U.S. engagement in global health and multilateralism more complex. And so we have to, of course, track this closely and try to understand what this means so that global health organizations can continue to position themselves and the broader global health architecture for success in achieving our health goals. And we need to be clear-eyed about that. We need to be honest about that. It's the question specifically that I know raises about the U.S.'s engagement in WHO. I mean, the short answer is we, of course, don't know, but we know what the campaign said. And the incoming administration has been very clear and transparent in stating its positions, including that its position is that WHO is an organization that needs significant change and reform, and that they may well withdraw the U.S. from WHO again or announce that withdrawal. But it's important to note that even in that context, the incoming administration is likely as transparent as it is about what its positions are and what it wants, because it is interested in seeking change and seeking different outcomes. And so even if the United States does withdraw from WHO, that process, as many of you know, takes a year to finish. And the United States could make changes to the funding it provides to the WHO, but it can also at any point withdraw an announcement to withdraw and continue to stay a member state. It will continue to engage in WHO governing bodies and processes throughout that year, we expect. And they could choose to increase funding or restart funding at any time following work or agreement to achieve the changes in the organization that it wants to see. So it's not the end of the conversation, it's the start. And we should also be very clear-eyed in how we look for opportunities in global health, including in this particular space, and we're doing that at WHO. And then lastly, I just want to end with one point about WHO's role. No election is going to change WHO's core principles and WHO's approach to its work in convening countries and working through complex health problems in multilateral ways. That's not going to change. There's nothing about WHO's core mission or core approach to the work that will change. But I think one thing that might change is that WHO is likely to become an even more important voice on global health issues and on science and on data and on evidence in health for our countries if other voices recede or change the role that they play in that space. And it's also worth noting that multilateralism must adapt and evolve, and I'm sure we'll talk about that more in detail in discussion. But it remains a powerful tool for collective action and a better tool than any other option, certainly, that I'm aware of. So I think that we should have a robust discussion now and in the future about how to help multilateralism and WHO and all of our organizations evolve and engage in the world that we will live in, because it will be a different world than the one we have. Thanks very much. Looking forward to hearing from other speakers and to questions later on.
Thank you. Great insights. I love how you started with, let's celebrate what we've been able to achieve so far in the multilateral space. And I think you bring up good points. There are a lot of challenges to working in the multilateral space, but there are also a lot of things we can achieve being in the space and in all of the negotiations. And in our advocacy to the US government and even other governments, I think it's important to shed light not just on what's not working, but what has worked and how that's benefited not just the world, but the American people, which I think is going to be a message that will be really important coming into 2025. So we'll come back to more discussions on that. I'm now going to move over to Carrie. So over the past few years, we've been seeing how climate change, conflicts, endemics, and pandemics have affected our health systems. So what should we be prioritizing in 2025? Oh, and you're on mute. It's okay, common mistake. We still cannot hear you for some reason. I'll give you a minute. No, we still can't hear you. If it's okay, Carrie, why don't you figure out the audio and, oh, I might be able to hear you now. Say
Can
something.
you hear me?
Yes, I can.
Sorry.
Technology, it happens. Don't worry, over to you.
Yeah. Anyway, good morning or good evening, wherever you are in the globe. I'm delighted to be with you here today and to share my thinking on global health resilience. And I think you'll hear some common themes from our previous speakers. I want to start by thanking Alicia and Eliana for their kind invitation to this panel, for organizing such an important event, and really for all they do all year round to advance global health. Some of you may have heard that my organization, Global Communities, recently combined with IntraHealth International, which is a highly regarded global health organization, also a member of GHC, with a shared commitment to saving lives, advancing equity, and delivering the next generation of solutions for global health. So I just wanted to let people know that. Together, we have an unwavering commitment to health workers who are the backbone of every nation's health service delivery. Because we work in both humanitarian settings and stable environments, we take a holistic approach to our work, one that considers the social determinants of health through our own programs and by intentionally linking with others as a way to improve overall health outcomes and reduce health disparities. Our joint vision is a world where crises give way to resilience and all people have the healthcare they need to thrive. Resilience is at the forefront of everything we do, both in crisis settings and in relatively stable environments. So what is health resilience? I mean, simply put, health resilience is the ability of individuals, families, communities, and health systems to prepare for, adapt, recover from, and thrive in the face of health-related adversity, including but not limited to public health emergencies. A resilient health system is able to effectively maintain essential health services during times of crisis, including pandemics, conflict, and extreme weather events or climate change. Health resilience encompasses the physical, emotional, mental, social, and systems capabilities needed to support sustained human well-being in a world of challenges. In an increasingly complex and fragile world, strengthening health resilience at all levels is crucial for improving overall health outcomes and ensuring that individuals and communities can thrive, even in the face of adversity. So what are some of the top threats to health systems worldwide? And you heard some of them today already. It feels like health is at a tipping point now. Around the world, health systems have barely recovered from the worst of the COVID pandemic and are constantly being pushed to the brink by new challenges. While conflict, environmental changes, and other emergencies have different root causes, they all increase human vulnerability and have a significant impact on health systems and the delivery of health services. Most importantly, they dramatically affect the well-being of communities. And I think you heard some of the statistics earlier from Ndidi. And in all of the situations with some of these worsening statistics, it is the communities who are least able who shoulder the bulk of the world's humanitarian crises. It is the communities with the fewest resources who are the most affected and least able to protect themselves, not just from disease, but also from the health-related consequences of climate change and rising conflict. And it is these communities who are least able to pay for needed health services when emergencies arise. We are gathering after our own national elections in the US, and we've had some talk on that. I really appreciated Justin's insight into that. The future is yet to unfold, but we know that as with any transition administrations, changes will come for sure. We are all preparing for these shifts, which could dramatically affect our health leadership in the world. In terms of global fragility, it is no secret that the pace of change is accelerating dramatically, and the extraordinary development progress we witnessed in the 1990s and the early part of this century is being reversed as a result of pandemic disease, rising conflict, and increasing migration and displacement of people. Sadly, we are also witnessing dramatic health consequences for affected populations, from acute malnutrition in conflict zones to outbreaks of diseases not seen in decades, such as polio in Gaza. We are also seeing the growing impacts of the climate crisis on the health and well-being of people around the world, especially children, who are uniquely vulnerable to environmental hazards, such as air pollution, extreme heat waves, droughts, and resulting water scarcity and malnutrition. Needless to say, conflicts and natural disasters not only pose direct threats to the health and well-being of affected populations, but they also disrupt the ability of local health systems to deliver life-saving support to people in need. It is absolutely essential to strengthen community health resilience so they can be better prepared for and recover from these crises. So how can we strengthen the resiliency of health systems? We live in a very dynamic and complex world with a pace of change that is accelerating every single year. So we need to be more nimble, adaptive, and innovative as we collectively work to advance global health goals. I have 4 recommendations for strengthening health resilience globally. First, echoing Eliana in her introduction, we need to increase investments in global health and in global health security in particular, and integrate disaster risk reduction and management into health system strengthening interventions. Secondly, I want to echo Ndidi, we need to break down the silos, and I'd love to talk more about what that means in the Q&A session if that is of interest. I love to recall to leave our logos and our egos at the door and go far and fast together. And I'm also really heartened by the multilateral progress that Justin highlighted. Number 3, I just think that perhaps the most critical component of any resilient health system is a robust health workforce, one that is rooted in the effective delivery of primary healthcare services, but can also pivot to meet the ever-changing demands of the multiple crises that we face today. While health workers are the backbone of the health system and stewards of health equity, there are far too few of them, and many of them are overworked and undervalued. The World Health Organization estimates a shortfall of 10 million health workers by 2030. We not only need to push for strategic investments to not only increase the number of health workers, but also to ensure that the health workforce is adequately compensated, trained, supported, and protected at all levels of the system, from community health workers to nurses to specialists in tertiary care settings. We also need to continue pursuing robust digital health and data science interventions that can equip decision makers from local communities to national governments with real-time data, evidence, and innovative solutions to improve health workforce management and performance. And Ndidi talked about the importance of data. This also means better connecting the dots and the data at the intersections of human, animal, and environmental health through the One Health mindset. And then perhaps most importantly, we need to prioritize locally led solutions. And this is something we've also discussed. Health systems are led by local professionals, and they are the answer to more sustainable and effective population-based work. This is especially true and important in post-conflict settings where rebuilding institutions requires local knowledge, leadership, and trust. Local communities, governments, and organizations should always be at the center of their own leadership and development. We need to support them to the best of our ability. So I would like to advance a call to action. We absolutely must keep advocating for strong evidence-based solutions and increased investment in global health. Now more than ever, I think we need to carry the message that helping other nations build the foundations of human well-being, prosperity, stability, and peace, we can assure our own leadership, economic growth, and national security. We need to keep amplifying the message that disease knows no borders and that investing in global health security makes America safer and healthier too. So that is my initial thinking related to global health and resilience. I'd be happy to unpack some of these initial questions that Eliana raised in her introduction in more detail if you're interested, but happy to be here and really grateful for the insights of our panelists. Thank you.
Absolutely, Carrie, and thank you for those great recommendations and call to action. I think the breaking down silos is a really important topic, and would love to come back to you on that. But I like the way you framed, health resilience and how it can be an answer to a lot of health security issues that I think the U.S. government coming in next year, that kind of messaging will, I think, ring true to them. If you say pandemics, they have no boundaries. These are national security issues. They should be on the forefront of your agendas. Framing it in that way, making sure that our health systems are resilient so that we can protect ourselves from these, I think is really, really important. So thank you for shining some light on that. I'm moving now over to Kate. So sexual health and reproductive health rights and maternal newborn child health has always been, in some aspects, a partisan issue in the United States and even across member states within the United Nations. We're going to see a lot of changes in SRHR and MNCH policies and investments. So tell us some of your thoughts on that, what things might look like next year, and what can we do in our advocacy to continue to protect those important policies.
Thank you so much, Eliana. And I'm going to hold some of the points that my colleagues have made, but one thing I want to start with is just some facts. First is that sexual reproductive health and rights and MNCH programs work. For example, between 2000 and 2020, approximately 3 million maternal, 50 million children under 5 lives were saved globally through those programs. Neonatal mortality fell by 54%. Child mortality fell by 59%. Access to contraception has prevented around 3.7 million maternal and newborn deaths, and contraceptive use has prevented an estimated 123 million unintended pregnancies, reducing unsafe abortions and maternal deaths. I want to pause with these successes, just like Ndidi has shared, because it just shows us how much progress we have made and how much our engagement has helped. It is attributable to the work of the many advocates, practitioners, governments, communities, donors, multilateral stakeholders across multiple continents and communities over the past many years. And I want to acknowledge these contributions because they are an indication of what we could continue to do together. There is more work to be done, obviously. The data also shows us that an estimated 287,000 women died in 2020 alone from pregnancy or childhood-related causes. In 2021 alone, 2.3 million newborns died. An estimated 5 million children under 5 died. And 23 million children missed out on routine immunizations, leaving them vulnerable to preventable diseases. Every year, 12 million girls aged 15 to 19 and 777 girls under 15 give birth. Complications from pregnancy and childbirth are the leading cause of death for girls between 15 and 19 in countries with constrained resources. And every day, over 1 million STIs are acquired daily worldwide. Many of them go undiagnosed or treated and lead to infertility and other complications. I'm rattling out this data because that is why we do the work. That is why we must continue to do the work. We know the sources of these challenges. They continue to be around the things we fight for geographic, economic, and social access to essential services, to strengthen weak health systems, as Carrie has said, because if we don't have the health infrastructure, if we don't have the health care force, we will not be able to provide quality maternal and newborn care. We have cultural and legal barriers that foster gender-based discrimination and limit women's and girls' access to these services. We continue to have humanitarian crises all over the world, either through conflict or through climate displacement. And they continue to strengthen the pull that these challenges have upon us. And recently, we have NCDs, non-communicable diseases like hypertension, diabetes, and obesity that are increasingly affecting women of reproductive health and complicate childbirth and pregnancy. These are the things that push us forward. We have a challenge with the funding. Ndidi has showed us how much the funding has reduced over the past few years. We are concerned, we hold our breath tightly because we expect more reduction in funding. But what I'm coming to us with is that these challenges give us the backbone, actually, to look for other ways to engage. I remember at the beginning of the fight for HIV, the environment was tough. There were governments that did not even want to engage, but advocates fought and engaged at multiple levels. In countries, at the country level, at Congress, there were lobbies for Congress, and at multilateral levels to move the agenda forward. This is the time that I want to call us back to that thing, to the fact that the data that we are seeing, the need that we have, demands that we do not fold our hands and look for and be concerned, that we look for nuggets of hope. Even in the Project 2025 document, we look for the fact that they are concerned about women and children. And we are concerned about women and children. And we have to show them, as Ndidi said, the link between all of this and economic impact. We have to find ways of articulating the commonalities between the way they are thinking and the way we are thinking. I remember in Nigeria when we were working and we were concerned with religious blockades to our work and family planning. And we started calling it child spacing. So let's look at our language of advocacy. Let's present the data, look at our language of advocacy, and present them in ways that are mutually beneficial. I was listening to Elisha yesterday, actually, but during the Global Health DevEx roundtable. And she indicated that the advocates that are here, reminded us that the advocates that are here, it's not one size fits all. There are people on the rightest side of the divide. There are people on the leftist side of the divide. What brings us together is one thing, that we want a future, a world where women, newborns, and adolescents and children have the access that they need and the resources they need to thrive. Let's coalesce around that. Let's work on strengthening our multilateral engagements. Let's look at the impacts that we can have through localization. One of the things that people think about localization is engagement. And we need to hold also the governments in those countries accountable to funding some of the services that we need in those countries. That we have multiple social accountability mechanisms that have worked, and we should lean in on those at this point in time. And we should coalesce, no more silos, coalesce even together in this world. There are multiple organizations that work to lobby. Congress, USGLC is there, Global Health Council is there, others are there. This is the time that we want to hold ourselves together and strategize and provide data as it needed and utilize digital technology as it needed and utilize AI as is needed just to bring us together. It is a time to tighten our belts and move forward and figure out what are the ways. For example, America First is not America alone. These are going. So let's lean in on those commonalities that we can find and try to figure out ways to work with this organization. This administration, the US, of course, is the biggest funder. So when the US sneezes, the whole world catches a cold. So we have to engage at this time. Multiple trips are happening to Congress. Our colleagues that are our counterparts for lobbying are busy, and we need to help and continue to shore them up together. I will stop there. I know there's time for multiple conversations that we can have, but we cannot stop on our desires for equity, for comprehensive sexuality education and services, and for access, especially to those that need the most help in emergency situations, in humanitarian situations, in refugee settings, in crisis settings, where just those environment already push the boundaries for services just to the utmost. Let me stop there and look forward to more of the conversation. Thank you.
Very powerfully stated. And I love that our panelists are also shining light on a lot of the positives, which I think we need right now. Remembering our common goals. I love that. Doesn't matter what side you sit on, we do have some common goals, and maybe we need to remind ourselves what those common goals are and change our language a bit so that we can come together more easily. Finding other ways to engage, that's another great thing to think about as we're thinking about how we do our advocacy in the next year. We're not going to be able to do it the same way that we've been doing it the past 4 years or even before that. We're going to have to change the way we do things, the way we say things. So thank you for bringing that up. Now is a great time for you all to drop any questions you might have in the chat. I have a few questions that I can get us started with, but if anybody else wants to come in, raise your hand, or again, put questions in the chat. I'm going to go back to Ndidi. You put up that really impactful graph of the downward trend in financing for health. And I know last year, during the high-level meeting on universal health coverage, we were trying to do a lot to push governments to really invest in health financing and to commit to investing in health financing, and not just saying that they're going to do it, but explaining how they're going to do it. I'd love for you to talk a little bit more about what we can do to help move those investments along, particularly at the country and regional level, but also within the United States. Like, what is some of the messaging that we can use to convince people why it's so important to invest in global health?
Thank you so much. I think I want to first commend the panelists, Carrie, Kate, and Justin, who have made very compelling cases for why we need to continue to invest in global health and why we cannot go back. But we need to show it in numbers. And the more we can make it clear from a business case perspective about how connected we are in health, how a pandemic somewhere affects someone else, how, investing in health makes business sense, even for G7 countries that benefit from some of those investments. I think it's critical. But beyond that, I think we have to increase the efficiency and effectiveness of the funding that has been given or is available. And I think everyone is pushing for efficiency and effectiveness and transparency in the use of funds. And from the African lens, I think it's important to note that countries are already giving significant amounts. If we think about Gavi, for example, and how countries do match for every $10 that is invested, I think in some countries, up to 7 of those $10 in terms of the cost of drugs are being covered by African countries. And I think showing that is important, because the narrative that we're just on the receiving end is one that is widely accepted, and the recognition that countries have gone up and continue to increase their contributions to the cost of medicines, the cost of services is really important and should be well understood. And beyond that, we also have to increase domestic resource mobilization for health financing and involve the private sector in greater ways, and find catalytic tools and de-risking tools for the private sector in Africa to invest in health. And we're starting to see more of those trends. So we have to share those success stories, because investing in health not only is good for us, but it also can be a profitable venture. And we're seeing that with the emergence of the Africa Vaccine Manufacturers Accelerator, which is a welcome development, and seeing private sector rally around that. So for me, I think there are lots of different tools that we might use, and it's a multi-pronged approach. But to be sure, One Campaign is very excited about thinking through the future of health financing from the African lens, where Africans own their own health financing mechanisms, and we're partnering with a lot of other organizations, and you'll be hearing a lot more from us next year as we plan for this and work alongside our African governments and African leaders to define what that future looks like.
Wonderful. Thank you so much. Yes, I think that there's a lot of data out there that we can show demonstrating what's already happening, investments that are already being made, but also supporting domestic resource mobilization will be key as well. So thank you. Those are all great points. I did have a question for Justin. Considering that there are thoughts on the United States possibly pulling out of WHO, and you've talked about the different ways that might look like in the next year, it might be helpful for us in our messaging to also talk about what the risks of doing that might be. So I'd love to hear from you about, if we were to pull out, like, what would that mean for the United States? What would that mean for a lot of these global initiatives that they've been supporting over the years?
Sure. It's a great question, certainly on the forefront of all of our minds right now. I think I'll start just by saying it depends, because it depends highly on the sort of, on the exact and the steps that the administration actually takes. So we can theorize and we can share information on what we know, but it's really, we don't know. But some of the things that I think, and I'll focus a little bit more on funding, some of the things that would go away if the United States reduces or eliminates funding, as it said it would do in 2020. The WHO relies heavily on voluntary contributions from all of our member states and other funders to do some of the really important work that we do across our portfolio. But in particular, the US government has funded our response to health emergencies and funded the World Health Emergencies Program at WHO to a significant degree. So if that funding goes away and is not replaced by, other new contributions from other donors, or is not shifted to other organizations in global health, I think one of the biggest impacts will be a dampened ability to respond to humanitarian and health emergencies around the world, including the ones that we're in the midst of responding to now. So that's a very big deal. And it's also worth noting that there's a long history of bipartisan support in the US, in the Congress, across administrations for humanitarian assistance, humanitarian and health response. And so that's something that, we're concerned about. We don't want to go away, and we plan to engage and work with the new administration on to make sure that we're not creating gaps in things that we know they care about and we know both parties care about here in the US. I think some of the other things that will be challenging will be, just an ability to keep up with some of the major initiatives that the United States funds. So we're concerned about polio, we're concerned about pandemic preparedness, we're concerned about influenza, we're concerned about infectious disease. These are things that the United States supports strongly, both with funding and with technical assistance and technical support, staff time from US agencies, technical participation on advisory groups, advisory panels that help WHO generate its guidance and recommendations and do its normative work. The US plays a huge role in all of these things, and these things also benefit the United States. So it's a two-way street, right? We're concerned at WHO about impacts on our work, but it's also worth noting that these things have value to WHO. To the United States. And the United States and United States private sector actors rely on a lot of WHO's normative work and normative guidance to create and facilitate its market activity and its ability to sell its products around the world. The FDA supports the WHO pre-qualification and emergency use listing programs. We partner closely with US agencies on all of these things. So these are things that we're concerned about being unable to fully fund or fully implement some of these things at WHO, but we're also concerned about the impact on all member states, including the United States, if that funding goes away. And then I think the last thing that I'll say outside of funding is that the United States has tremendous influence on global health policy through its participation as a member state in WHO governance processes and governing body functions, through the World Health Assembly, through the executive board. And it's really important to remember that influence in global health policy is also applies to all member states. So when the WHA passes a resolution, it applies to all 194 WHO member states in the same way. And that includes a lot of member states that the WHO historically does not have constructive relationships with or any relationships with. And yet it is still able to influence positive health policy outcomes through its engagement at the WHA and the executive board and in other processes at WHO. So the US risks losing influence over positive health policy outcomes all around the world. And that's a little hard to articulate, certainly impossible to quantify, but it's a very big deal. And so that's something that we're looking at as well. And then, the questions that are a little harder to answer about what the United States would lose in terms of information and coordination and its ability to respond to its own health threats and to participate robustly in global health emergency response in the future is a little harder to untangle, but is also very, very important. So the United States, as I said, provides a lot of experts at WHO as secondments from federal agencies. They provide a ton of technical input from here in DC and Atlanta and elsewhere on the US side. They join WHO missions to do disease response, outbreak response, to do disease investigations, to do research and development. They're part of clinical trials networks that WHO coordinates. They are part of advisory bodies on antimicrobial resistance. I mean, I could talk for another half an hour about the number of things that we do that are important and that the US supports. So there's a lot of implications that we know will be significant, but we don't fully know how they will play out. Because as you all recall, in 2020, when the administration announced it would withdraw, that withdrawal wasn't actually effectuated because of the timeline in our subsequent election. So there's a lot we don't know, and I'll end on that.
Yeah. Yeah, and I mean, thinking about creating a vacuum, and also if we're not there, who's going to fill that vacuum, and what that's going to look like and mean for the United States is important to think about. And very good point on this is an opportunity or a place where the US can influence in a really positive way, having a health impact in different countries around the world, which in fact does have an impact on the United States too. So I think you made some really great points on that. Thank you. I'm moving to Carrie now, and I'd love for you to talk a little bit more about how can we break those silos in an effort to strengthen our health system. That is the age-old question, and I'm really curious to hear what you have to say about that. And I see a hand is up, so we can go over to the question after.
Okay, thank you so much. First of all, I want to say especially in an era of reduced funding.
Oh, sorry. So your audio sounds very far away.
Oh my gosh, can you hear me?
You still sound very faint.
Can you hear me now?
Still very faint. I'm not sure what happened there.
I am so sorry. Can you hear me now?
Much better.
I don't know.
Yeah, when you're closer to the mic, it works.
Okay, I'll just put my face right up here. I would just say that, especially in an era of reduced funding and the possibility of reduced US leadership, collective action is critically important. I also want to draw attention to David Bryden's comment in the chat that local and national leaders can be very, very effective advocates with Congress and the administration. But getting back to my question, I think we need to do a much better job of working across silos, both in terms of our work and our work, especially with other health actors, but also with other community and national stakeholders to address some of the non-medical factors that strongly influence health outcomes and contribute to health resilience. Some of those other topics, other sector issues are areas that could potentially have more support from US leadership. So this really involves addressing social determinants of health, as well as the elements of a One Health approach to look across animal, human, and environmental factors. Sort of key to this more holistic approach is considering the broader environment in which people live, including the effects of climate, although that may be something we need to change the words on. It also means including other factors such as access to economic opportunity, including livelihoods that bring people into close contact with animals. Also means education, social and community connections, and housing and physical environments. So understanding and addressing these broader factors by finding ways to link health programming with programs in these other sectors for more holistic approach, I think is really key to improving overall health, reducing health disparities, and fostering health resilience, and possibly bringing in constituencies that have more support in the US government. I also think that there are policy and advocacy areas from other sectors that dramatically improve health access. I mean, not only improving or promoting the access to health care, but also work to do around environmental health and sustainability, issues related to affordable housing, food security, living wages, access to education. All of those things are critically important to health outcomes. So I would just add that, sort of end with by saying that we need to work outside of the health sector to bring other constituencies to the table. I think we want to, now more than ever, bring in the private sector, other philanthropic partners. I think we want to consider other business modalities such as impact investing and carbon funds and carbon credits and many other sort of financing tools that are available to bring in elements of health service delivery for the betterment of all.
Thank you so much. And I think that you answered one of the questions in the chat on, what can health advocates do if the administration withdraws from various different funding and international support. I think we have to go to other partners and other stakeholders and really get them involved to fill that gap. So thank you for that. And I know we're coming very close to the end. I did see Ashley have a hand up, and I did want Kate to come in one last time. So maybe Ashley, can you just come in quickly with your question, and then I'll give Kate the last word and we can wrap up.
Sure. Thank you for this wonderful panel, and thank you for all of your fantastic insights. I'd very much appreciate it. My question is more, is there anything that we can do as a community, in your eyes, and this is for the panel across the board, given Congress's and the administration's focus on oversight, accountability, transparency, and particularly reforms, are there suggestions we can make back to them on what we think would be a better reform for WHO or for USA, the Bureau of Global Health, or how humanitarian funding can be spent more effectively? Thanks.
Anyone can come in on that.
I'll make one point, and that is, I think the most important factor is leadership.
Oh, we can't hear you, Carrie. I'm sorry.
Never mind.
Maybe try muting and unmuting. That seems to help. In the meantime, anybody else want to come in? Yeah, go ahead.
Okay, go ahead, Justin.
I'll be very brief. I think it's a great question, because I think one thing about this incoming administration is that they're relatively transparent. They've told us what they want, what they like, what they don't, what they support, what they oppose. And so I think digesting that and looking for opportunities to make suggestions of ways to help them accomplish their efficiency goals or their, financial cost saving measures. I mean, there's a lot of really good things one might suggest. And I think that creative thinking will be key, because I think in the vacuum of that, they will revert to perhaps less sophisticated methods of cutting budgets, or of reducing programs, or of saving money that are about not spending rather than spending better in one case, or that are about not achieving health goals rather than achieving them more efficiently. So I don't think this will be easy, but I think it's a great question with a great premise, and the global health community should engage that very seriously and very directly, and use our best thinking to try to contribute to that conversation, because it's a really constructive way of moving forward. And this is the world we live in.
Yeah.
Great, thank you. And Kate, I'll give you the final word before closing.
I just want to actually use my final word to reiterate that is to be proactive. The administration has, if you haven't read Project 2025, I guess you should read it. They have signaled people by the people that they have nominated to positions what things are going to look like. There's some hope in Marco Rubio, for example. There's consternation in a RFK, for example. But I think what is important is that we very actively find avenues to present the options that we prefer in the context of their broad desires. Like, they have articulated broad desires for us, and we should hone in on those broad desires and then present options to them. Many of the people that I've spoken to, even within USAID and some of the governments, change is good. change can push you to innovate. In fact, that is what pushes you to innovate. And so we should welcome this as an opportunity to look inside and think of how we can do better, and present back those options so that, just like Justin said, really, they don't do it all by themselves. Thank you.
Thank you. And Carrie says, and leadership matters. So advocating for strong, capable leaders who can lead with integrity is critical. Thank you, Carrie, for sharing that. Well, I wish we could continue, but we have to end this panel. I loved ending. Kate, you're so inspiring and very positive outlook on the future. So thank you for those final words. I just want to thank our panelists for this great plenary. These weren't easy questions to tackle, I know, and they're not easy answers, but we so appreciate your insights. And I also want to thank our participants for your time and attention the past 4 days. I know this seems like challenging times, but I found that in every challenge, we have opportunities that are just waiting for us. So let's continue to come together to find those opportunities to protect health globally. Thank you so much, everyone. Goodbye.